Today's topic of discussion is nasal cavity. I'm Dr. Muhammad Sharjeel Ilyas, working as Assistant Professor in PGMI AMT Lahore. Objectives of today's topic are to know the functions of nasal cavity, parts of nasal cavity, anatomical parts, bony skeleton of nasal cavity, along with cartilages, openings in nasal cavity, blood supply and venous drainage of nasal cavity, nerve supply of nasal cavity, and clinical significance of nasal cavity. First of all, nose is the part of respiratory tract superior to the hard palate and contains a peripheral organ of smell. It includes external nose and nasal cavity, which is divided into right and left cavities by the nasal septum. The functions of the nose, first and foremost, the respiration or breathing. Then it is also responsible for sense of smell, olfaction. It warms and humidifies the inspired air and removes the pathogens, start pathogens, and dust particles. Filtration of dust is also another function, and it also provides an area where many of the paranasal sinuses and lacrimal ducts drain. The external nose, the visible part or portion that projects from the face, is called external nose. It contains the root and the apex or tip, and the area between the root and the apex or tip is called dorsum of the nose. The inferior part of the nose is divided into two apertures with the help of ala. These apertures are also called nares. We'll see in the next a few slides that nose is formed by the skeleton of the nose is formed by bones and cartilages. Superior bony part, including its root, is covered by thin skin, while the skin over the cartilages of nose is thick, having sebaceous glands. The skin extends into vestibule of the nose or openings of the nose, where it has a number of stiff hairs which are called vibrissae. The skin that separates two anterior nasal apertures or nares or nostrils is called columella. So after the vibrissae, there is junction of skin and mucous membrane. Now the nose is the most prominent part of the face, having two piriform apertures. So these apertures are divided by a nasal septum into right and left nasal cavities. The bony skeleton is formed by a nasal bone, maxilla, and other bones which we will discuss separately. But there are five cartilages. First of all, septal cartilage, then alar cartilages, two alar cartilages, and two lateral cartilages. Septal cartilage is shown in dark blue color, while two lateral cartilages are shown in green color, while major alar cartilages are shown in purplish color. There are also a few minor cartilages also present, while the vestibule is formed by fibrofatty tissue having sebaceous glands. So we divide nose into a central part or septum, which divides two nasal cavities and two lateral walls. Now the septum of the nose is formed by different bones. The major bone, which is shown in green color, is the perpendicular plate of ethmoid bone. It is forming the roof and most of the part of the septum. So the cribriform plate is also present here, which connects nose to the anterior cranial fossa. Behind it, there is sphenoid sinus, which is shown in yellow. So, a small portion of the nose is also formed by sphenoid bone. Then, the major part, forms posterior inferior area of septum, is formed by vomer. And in blue color, there are septal cartilages, which form the nasal septum. Now, the lateral walls of the nose, right or left, they are formed also by ethmoid bone, which is shown in green color, having superior concha, middle concha, and uncinate process of ethmoid bone, and a very small lacrimal bone, then frontal process of maxilla. There is inferior concha, an individual independent bone shown in the brown color. Then the posterior inferior part is also formed by two major bones, perpendicular plate of palatine and medial pterygoid plate of sphenoid bone. The floor of the nasal cavity is formed by hard palate, and this hard palate is, as you know, is formed by the horizontal processes of maxilla, a palatine process of maxilla, and horizontal process of palatine bone. There are major and minor alar cartilages, as well as lateral process of septal cartilages. Three things we need to remember while discussing nasal cavity. These are three openings. First of all, incisive canal. Incisive canal gives way to the nasopalatine nerve, to the oral cavity, and the second one is sphenopalatine foramen, which joins nasal cavity with pterygopalatine fossa, and it carries sphenopalatine branch of the maxillary artery, nasopalatine and superior nasal branches of the maxillary nerve. And the third and very important is cribriform plate, uh, by which fibers of the olfactory nerve pass through from anterior cranial fossa to the nasal cavity. And there is also the presence of olfactory bulb and olfactory nerves. And obviously, the endpoints are olfactory receptors. Then there's also passing anterior ethmoidal nerve and accompanying vessels. So the nasal cavity is divided into three main portions. First of all, vestibule, where the vibrissae are present, the staphyrs, presence of staphyrs, and this vestibule, the termination of vestibule forms the border of skin and mucous membrane. Then in the brown color, there's respiratory region having the epithelium, which is respiratory in nature, and there is superiorly on the roof there is olfactory region related with the sense of smell. Concus. They curve infero-medially, hanging like short curtains from lateral wall, and the area between two concas or a recess is called meatus of passage in the nasal cavity, and it underlies each of the bony formation. Nasal cavity is divided into five passages by the help of these concas. So we have on the lateral walls three concas: superior concha, middle concha, and inferior concha. These are bony projections which divides the cavity into three portions, and we have three passages or recesses shown in this picture: the superior meatus, middle meatus, and inferior meatus. Another picture showing concas and recesses or passages, meatuses. They are very important as far as the openings of many of the sinuses are concerned. Especially, we divide this cavity or lateral wall or the nasal cavity, with the help of these conchas, into five passages as we have already discussed. First of all, sphenoethmoidal recess. It is just anterior to the opening of sphenoid sinus or sphenoid sinus, posterior superiorly located, and provides passage for sphenoid sinus. Then we have superior meatus having opening of posterior ethmoidal sinus. Then a very large opening which is called middle meatus having opening of anterior and middle ethmoidal sinuses by the way of ethmoidal bulla, and then through semilunar hiatus or hiatus semilunarus, there is opening of frontal sinus, and there's also opening of maxillary sinus. The third one is common nasal meatus. It is located medially. It does not have any openings, while the fourth one, the inferior meatus, provides opening for nasolacrimal duct. You need to remember all these openings. As the picture shows, we have four sinuses: sphenoid, ethmoidal sinuses divided into three: anterior, middle, and posterior ethmoidal sinuses, then maxillary sinuses, and frontal sinus. Just repeating the lecture, a portion of the lecture is the opening of frontal and maxillary sinus, two major sinuses. It is present in the middle meatus. While the ethmoidal sinuses, among three ethmoidal sinuses, two, anterior and middle, they are also opening in the middle meatus. So we have openings of four sinuses in the middle meatus: frontal sinus, maxillary sinus, anterior and middle ethmoidal sinuses. While in the anterior meatus, we have opening of posterior ethmoidal sinus, and in the sphenoethmoidal recess, there is opening of sphenoid sinus. In inferior meatus, we have opening of nasolacrimal duct. Here's a summary showing all the openings. As the auditory tube connects the middle ear and upper respiratory tract, it is a path by which infection can spread from the upper respiratory tract to the ear. Infection of the auditory tube causes swelling of the mucous lining and the tube becomes blocked. This results in diminished hearing. So, having flu or sinusitis or any infection of the nasal cavity may also affect the hearing. This is due to this passage. Now, the blood supply or vascular supply of the nasal cavity, it's very important clinically as well as anatomically. We have two arteries, major arteries here: internal carotid artery and external carotid artery. Both of them supply the nasal cavity. Internal carotid artery gives a branch which is called ophthalmic artery, and two and arteries, anterior ethmoidal artery and posterior ethmoidal artery, comes out from ophthalmic artery and provides the nasal septum, especially the superior part. Then we have external carotid artery having a branch which is called maxillary artery, very famous branch, and a facial artery. The maxillary artery divides into two: sphenopalatine artery and greater palatine artery. Both of them, through sphenopalatine foramen and through greater palatine foramen, enters into the nasal cavity and provides the vascularity. While from facial artery, there is a branch arises which is called superior labial artery, and the septal branches of superior labial artery provides the anterior-inferior part of nasal cavity. So five arteries, they join each other in an area which is called Little's area. Very important clinically. Another picture showing the accumulation of five arteries: superior labial artery, septal branches, then anterior and posterior ethmoidal arteries, then sphenopalatine artery and greater palatine artery. They collect in this area And in any problem like trauma or hypertension or any other ecological problem, there is a profuse bleeding from this area, which is called Little's area. Normally, we call it anterior nosebleeds, commonly caused by trauma, including nose picking. Even this area is called Kieselbach area or Kieselbach plexus. It is present commonly in children and adolescents. While there is a Woodruff's plexus, like Kesselbach plexus present anteriorly in the nasal cavity, while Woodruff's plexus is present posteriorly and superiorly. This is formed by the maxillary artery, branches of the maxillary arteries, and it is in or normally occurs in elderly patients due to hypertension. And there is also nosebleed, but this is posterior nosebleed. Now the venous drainage. So they are all the same as arteries. They drain into cavernous sinus superiorly, anterior inferior drain into the facial vein, and posterior inferior drain into pterygoid plexus. Lymphatic drainage anteriorly, anterior half of the nasal cavity drains into the submandibular nodes, and the posterior half drains into the retropharyngeal nodes, and ultimately they go to the upper deep cervical nodes. Nerve supply is also very important. We have septal branch of anterior ethmoidal nerve. We have olfactory nerve, septal branch. This is the nerve supply of nasal septum, and we have nasopalatine nerve coming from sphenopalatine foramen. Now, as far as lateral wall of the nasal cavity is concerned, we have anterior ethmoidal branch, we have olfactory nerve, we have nasopalatine nerve. Uh, Actually, there are posterior superior lateral nasal nerves and posterior inferior lateral nasal nerves, which comes out uh, and provides nasal cavity. And both of them they come out through sphenopalatine foramen. So there are nasal branch of anterior superior alveolar nerve as well, internal nasal branches of infraorbital nerve, and external nasal branch of anterior ethmoidal nerve, supplying anterior inferiorly and anterior superiorly. Rhinitis, a clinical problem. The nasal mucosa becomes swollen and inflamed. Severe upper respiratory infection may be the cause of rhinitis, or allergic reaction or hay fever is also can also be the cause of rhinitis. Infection of the nasal cavity may spread to the anterior cranial fossa through cribriform plate, obviously, nasopharynx and retropharyngeal soft tissue, middle ear through the pharyngotympanic tube, paranasal sinuses, and lacrimal apparatus and conjunctiva through nasolacrimal duct. There is another clinical problem which is called deviated septum. It may be due to trauma, injury, or a birth defect. Deviated nasal septum, the symptoms arises from this deviation may be difficulty in breathing or recurring sinus infection. There are cravings one side for sleep, snoring, facial pain, nosebleeds, nose injuries, waking up to drink water. So these are a few symptoms which show that there is a problem in nasal septum. So another very common happening in nasal cavity is nasal fracture. This is the most commonest and weakest bone to be fractured. If the bones are not broken, then only wrist, eyes, compression, and elevation is a problem. Well, you need to fix it if the nose is broken by the reduction. Cribriform plate fracture, very important. Fracture of the plate can uh, cause problems directly into the anterior cranial fossa, having leakage of CSF and loss of smell.